Do you want to live longer and enhance your quality of life while doing so? My next guest knows exactly how. He's been studying his entire professional life. Dr. Peter Attia was a top cancer doctor who decided to give it all up. He wanted to help people before the disease got to them. His focus became giving people the tools they need to have the quality life before they had to fight for that life, including him. Despite being a workout fanatic, Dr. Attia says he had a dad bod around the age of 30. Something his wife said made him change all that and dive into the world of nutrition. Author of Outlive, the wildly best-selling book, is called The Science and Art of Longevity. He's the founder of Early Medical. Dr. Peter Attia joins us now. Great to see you.
Hey, Brian, thanks for having me.
All right, I want you to relive that moment. You just swam to Catalina Island from the continent, from Los Angeles. And what did your wife say to you?
She said I should work on being a little less not thin.
Well, I imagine you were in great shape.
I was in great shape for swimming, for that particular use case, but yeah, I probably was not, I was not on a great health trajectory.
So you're a brilliant guy, you're already having success. How did that change you?
I think that, coupled with the birth of my daughter, which coincided around the same time, just had me start thinking differently about what I wanted. Genetically, I know I've got a very strong family history for cardiovascular disease, so I kind of knew, at that moment at least, hey, if you don't do something, if you don't kind of start to fundamentally understand what it is that's going to take your life, you're not going to be around for maybe another 30 years. And I think, once you have a kid, you sort of realize, oh, actually, you have a longer time horizon on what matters to you. And if you enjoy having kids, you're probably going to enjoy having grandkids. And so I just wanted to be around a lot longer, and that became kind of my focus.
So what did you do?
Well, the very first thing I did was really start to understand cardiovascular disease, because that was the one that was nearest and dearest to my own heart, no pun intended. And, learned a lot about how we kind of weren't treating this disease correctly. We were waiting way too late in the course of the disease to treat it. We needed to be doing it far earlier. We needed to be much more aggressive. And then that kind of got me, of course, thinking about the other four horsemen of disease, because basically...
Which are?
Yeah, so cardiovascular disease, cancer, Alzheimer's disease and dementia, and then all the metabolic diseases that stem from diabetes. And that's basically going to kill most of us.
Fundamentally, you were bothered by the fact that people came to doctors when they've already had the disease to get fixed. You said, what if we beat them to the punch? Right. You said, here's an excerpt from your book, and maybe you want to expand on it. You say, Medicine 2.0 is set up to treat mental and emotional health in pretty much the same way that it treats everything else: diagnose, prescribe, and of course, bill. Mental health and emotional health are not the same thing. Our medicine and 3.0 thesis is that if we address our emotional health, we will have a better chance of avoiding clinical mental health issues such as depression, chronic anxiety, and overall benefit our health. Big difference.
Yeah, mental health is a very important part of healthcare, and I don't want to for a moment suggest that there aren't important things that need to be done to treat clinical levels of depression, anxiety, and things like that. But most people, myself included, are suffering more from an epidemic of poor emotional health, which is basically like, we're not that happy, and our relationships suck, and we're working too hard, but we don't really understand why, and we're trying to fill voids. You had a temper. Sure, absolutely. And so, to me, if you don't fix that issue, it actually doesn't really matter how long you live. If you're unhappy, if your relationships suck, if your kids don't love you and your wife is sick of you, who cares how long you live and how disease-free you are?
Most likely you're not going to be disease-free.
Well, that's true.
Because it manifests itself,
yep.
Right? So you also pointed out in the book there's people 110 years old who smoke and drank and had a hedonistic lifestyle. That's their genes. So genes are the most important thing.
Yeah, it depends on the age. So if you're talking about people who are going to live to be a normal lifespan, genes don't actually matter that much. So I don't know how old your parents are, but assuming your parents didn't live to, or your grandparents didn't live to be 100 or beyond, you have kind of normal genes, as I do. And the good news is we can outlive what's predicted by that. Where genes do kick in is once you start to get into the really, really rarefied air of living to 100. And at that level, the genes play such a powerful role, and it's not one gene, it's really a lot of genes. The genes are so powerful that you can almost do anything and be basically, immune from the consequences of it, such as smoking.
Gotcha. So if people watching right now can be proactive and take away some things that you just spent your whole career studying, what could they pull away?
And I think, lesson number one, I would say, is don't ever underestimate the power of exercise, both in its effect to lengthen your life, right? So nothing has a greater impact on what's called all-cause mortality, death from any cause, than being very physically strong and very physically fit.
Even as you get older.
Especially as you get older. Yes, absolutely. The second thing I would say is obviously go for the lowest hanging fruit first. So for most people, I do think exercise is the area where there's the greatest gap between what they're doing and what their potential is. But that's not going to be true for everybody. So I talked to some people who are sleeping 4 hours a night, and I would say, look, if you're sleeping 4 hours a night, that's a gaping hole in terms of your health. And before you fix anything, let's at least get that to 6 hours a night.
Gotcha. And a lot of the wearables that they have now, whether the watch or the rings or things like that, help you monitor those things. Those are all good things, right?
I mean, I hate to say that they're definitively a good thing. I think they are really good at creating awareness. But truthfully, Brian, I think people can go a little bit too far, myself included, and you can kind of over-monitor things,
right,
and you can create a little bit of analysis paralysis. So there are times when I'm telling my patients, take the thing off. Like, take a holiday from devices for 6 months, and let's just go by how you feel.
Right. You spent your entire career doing this. You're one of the smartest people in this country, and your conclusions really can change people's lives. And I really appreciate you doing it, and you deserve all the success you're getting. Pick up his book, Outlive, The Science and Art of Longevity. It's available everywhere. You will benefit, and like me, if you're not a scientist, you will still understand it. Meanwhile, on a separate note, thanks so much, Peter, for great to see you. History, Liberty, and Laughs. I'll be on stage in Henderson, Nevada, talking about everything about our past, also having some fun. It's all unscripted, VIP opportunities, too. Also, I talk about my book, the latest one, Teddy and Booker T. So live on stage, go to briankilmeade.com for tickets. Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.